I want to welcome you this evening. I'm Father Paul Hamilton from St. James Episcopal Church on the main street of Oneonta. Our church is 185 years old and has for a long time been involved in the issues of our town as it ought to. A little bit about me, I'm the new kid in town. Although I've been here some years back and I moved to Florida like all old people are supposed to do, but it never felt right and I missed this area, so I came back. And I'm privileged to be an adjunct professor at the State University here in town in the psychology department. I'm also a licensed drug and alcohol counselor, and most of you are my new patients. That was one laugh. I'm also a psychotherapist, and the rest of you are going to be my patients. Okay, thank you. So I've had a long career of teaching, doing therapy, and of course being in the church. I have been an ordained priest as of next week, 54 years. Thank you. Thank you very much. And I want to thank Mayor Drenick for the honor of being the moderator tonight. And he has been immensely supportive of me and our efforts to get more and more engaged in the issues of Oneonta. And I would call on him to bring greetings.
Thank you, Father, and thank you all for your attendance on a Thursday of kind of iffy weather. We'll be doing a very crisp presentation for everyone here. I want to thank our panelists. I have had the honor to have worked alongside so many of these folks in various meetings that I've attended. They are absolutely wonderful people who are so committed and so passionate, and the fact that they're taking their time this evening to share with you what it is that they do, because many people may not know what they do, what kind of challenges they face, what kind of successes they've had, and how you individually and collectively might be able to be either connective to or supportive of the work that they're doing. So this is an informational session. It will be followed. Again, thank you so much, Father Paul, for agreeing to moderate a Q&A that follows. I expect this is going to be very informative, very robust, and I know respectful. So thank you again for your attendance.
Thank you, sir. I'm also told that there are some young people here tonight from the State University of New York who have deep passions for community. And so we welcome them, and I trust that all of us will act like the adults that we want them to emulate us to be as time goes on. So let's get started. Each speaker has 7 minutes. And the first one will be Patricia Leonard, Family Services Association, and she is the Executive Director.
Thank you. Just want to make sure I can, sometimes my voice can carry throughout the whole room. So thank you very much for inviting me tonight. I'm the Executive Director for Family Services. We're located at 277 Chestnut Street, right here in Oneonta. Couple things that make Family Services unique is, first of all, we are not a state or federally funded agency. So merely by that, we are working off of private donations and the generosity of the community, opportunities that we have to write grants, foundations, small, opportunities with churches, fundraisers, mailing campaigns. So we are literally doing the work because of the goodwill of the community giving to us to make that happen. I often describe Family Services as an agency that is open to everyone in the community, and our clothing program really sets the tone for that because it is open to the community. Anybody who wears clothes and needs can come in and access the clothing room. With that being said, though, there are other times that your need for clothes is merely basic compared to the other emergencies or traumas that might be going on in your life. And at that point, then we can take you in, have a private conversation. We also are I know sometimes our location is often, we get complaints because it's not accessible to everybody and there's not large parking. But I will tell you, it is in a location that is accessible for those who don't have transportation and have to access bus, cab, rides with families or friends, or merely just walking in the community. So we have an open door policy, and you are greeted there by my staff and my interns with the utmost respect and dignity, and that's really what we give. But with that being said, we oftentimes find that people need us for more than just clothing or emergency service, but they need us for an ear to listen to, a person to talk to sort out problems, or to really get on the path of what they need. So at that point, I feel like we work as like almost a train station where we can talk to individuals, kind of create a relationship, a rapport. They build trust with my staff, my personnel, and then they are connected with services. We oftentimes see people 4 or 5 times a week because that's the needs that they present with, and they absolutely will get that respect, and they can come back as many times. We are 2 doors down from the warming station, so it is often become very convenient for those that are in need of the warming station to either access it before or after they leave. And we have showers that we've made available for people who need to take showers. Our challenges are merely the challenges that we all face in our lives, making good decisions, helping people find their path, working with individuals that maybe need another hand, a little bit more than some others. And we have the name Family Services because we treat everyone as part of a family that we're working with and helping. We're all family development credential trained, so we often do check ourselves and each other to make sure we're not working harder than our clients are at meeting their goals. And that's an important too, because we want to help people along the path, but we can't be doing all the work for them, which is part of the FDC model. Some of our other challenges is some are just merely being in upstate New York and the struggles we have with the economics, the weather, the transportation, the availability to funding, the availability to access everyone, medical, mental health, addiction, our struggles. But I have to tell you, some of the things that are more of my positives that I've seen is we have success stories that Family Services has right in this audience that you wouldn't even know were ever faced with these challenges, and they're sitting in the audience and they might be next to you. The other thing is everyone talks about all the negatives of COVID. I will be honest with you, I think this community is working more collaboratively than we ever have because of how we really were the results of COVID. So, I often say, I think we're working at a level right now that's very positive, very strength-based. These are individuals that I work with daily, the same people in the audience that I see on a regular basis as we're connecting to help people in the community. So, thank you.
Thank you, ma'am. Next is Steve Wilson, DSS, Otsego County Services. He is the Otsego County Administrator, and I happen to know that his big boss is sitting in the audience here, so I'm sure he's going to give us a brilliant report. Sir.
So if you have any complaints, I'll take them after the meeting, once Ed leaves. So I'm the mic.
Sorry.
I didn't want Ed to hear that last remark.
Yeah.
But seriously, folks, Actually, first off, this is the first time I've been to one of these community meetings. I'm not sure what they're about, but I am delighted that there are so many people here focusing on solving what you might coldly describe as a public policy problem. I'm going to bring a different perspective on this, an even closer perspective on this. All right, and that is, as Patricia told me right before we got up here, the money. Okay? So it's no surprise, I hope, that New York State takes homelessness pretty seriously, and they devote money and resources to it, a lot. Otsego County also does, and I want to describe what we do and some of the challenges, the restrictions on that. And getting support for housing, if you are a homeless person, can sometimes be a bureaucratic challenge. I think just about everybody on this table works with those issues, and they've been remarkably polite to me as the representative, if you will, of those perspectives. But let me get to it. Last year, Otsego County spent $1.3 million on housing people who are homeless, okay? We have about 10 people in our staff working on this pretty much full time. There are a couple of folks who work like 50% of the time, but that's what we have for this. Of that 1.3 million, about 800,000 of it comes from local taxpayers all across, including a lot of communities that don't have a homeless problem or aren't concerned about it. So what do we get for that money? Okay, now the county pays for a census that is done of homeless people, usually in the winter around January, and it's what they call a point-in-time census. People go around and try to find homeless people wherever they are. The last census countywide showed that there were, and this was last year, I believe there's one that's actually ongoing right now, but we don't have that data yet. But they found there were 66 homeless people, of which 56 had been housed one way or another. So there were 10 folks who weren't. And what may seem incredible to people is there are some folks who don't want to be housed or resist it for a variety of ways. Now, we've all heard of stories like mental illness, drug addiction, and stuff like that. Set that aside. I want to tell you some other reasons, okay? The thing is about getting housing, right? Counties are mandated. They are required to house anyone who's homeless. But homeless people are not mandated to accept housing. They don't have to. And for a variety of reasons, they won't. Those who do have to follow a fairly significant, I mean, I'm a bureaucrat, so I have a good sense of the complexity of paperwork. And, you know, it's probably more difficult than filling out your easy 1040, but probably a lot less difficult than establishing a corporation. Now, we have people, like I say, those 10 folks who help folks navigate that, negotiate that. But to some extent, that's kind of a barrier. But guess what? There's not a thing the county can do about that. And then once you're in housing, you're going to have to report, right? Are you looking for housing? There's some responsibilities that you have to take. one of these, let me just look at this note for a minute, because the form is kind of amazing to me. You have to complete an independent living plan, right? Like I say, I'm a bureaucrat. I can only imagine what that is. All of us probably can certainly see the logic of that, but we've got to implement that, and that is kind of a barrier. Now, I'm not standing up here saying we could solve all these problems if only the state would go away. That's not what I'm saying at all. We've got these rules in place. We got to follow them, but I want you to understand that as an explanation for some of the difficulty. Let me tell you how we spend that 1 point. Actually, let me put it a different way. I'm a budget guy, so I'm not like these folks. Let me tell you the places we do house folks. Okay? There, of course, there is the opportunity, the shelter. That's mostly for families, right? Motel 88, okay? The Crossroads Inn. Jeannie's Dream Motel in West Winfield. I don't actually know where that is. Do any of you locals know where it is? Okay. Well, I can confirm that we also send people to the Budget Inn, not here, in Herkimer. And indeed, if we can't find housing, all right, for folks who are eligible, right, and get through that process, we'll send them anywhere we can get them, and that's mostly hotels. There's one thing I do want to point out. The county has constructed its own housing, right? We have, I believe there are 6 things, we call them tiny homes. They're like tiny homes, right? And we have 6 of them. We're going to add 4 more this year. And those are right close to the DSS offices at the Meadows. So they get a lot of support, I think. It's a lot easier anyway to provide support for those folks. So we're doing that. But that kind of points to one of the problems that we see that maybe is really important. We can't find space, property, to put housing, right? Now, some of that is the real practical problems, right? Like Patricia said, you know, you need to be near bus lines, you need to accommodate people who can't travel, right? But there's also a NIMBY aspect of that too that makes it difficult. There is an opportunity about this, though. The state has significant funding available to build these kinds of things. So if we could somehow get it together across the county to do something like that, that is an opportunity. You know, I think that's about the best information I've got right now. So I'll be quiet for a bit and look forward to your questions. Thank you.
Jennifer Reynolds, who's the program director, Warming Station, Catholic Charities. Madam.
Thank you very much. All right. So I'd like to piggyback a little bit off of what my 2 colleagues have said too, as far as defining what homelessness is in the first place, because I like to use a phrase all the time that I think we paint people with a broad brush, right? I think we say, I'm sorry, I'm not usually told that I can't be heard. That's interesting. Thank you. Anyway, what I was saying was I normally, in my travels and working with all of these folks up here, we see homelessness, we call it painting it with a broad brush, right? You see someone who's down on Main Street and you assume that they're homeless and you think they're probably an addict and you know, are going to paint everybody who is in that situation with that broad brush. And like Patricia said, I see folks in the warming station that you guys would not believe. They are people that are teaching your children, that are sitting next to you in church, that have jobs that they go to every single day, and they have had to make choices between paying their rent or buying food for their children or paying their car payment because that's how they get to work, and maybe ending up living in that car because they can't pay their light bill. So the problem is so much deeper than what we think we see and what's on Main Street. So yes, obviously, some folks, there are addiction problems and there are mental health problems, and those, you know, we're all going to talk about it. You know, we don't have the systems in place to help our folks like we should. And it's, you know, the state, it's HUD, it's whomever we answer to. We, like Patricia, operate off of grants and off of the kindness of others. And a lot of times we don't know from minute to minute what's coming to help us. So we have in Catholic Charities, I was asked to speak about the warming station, but also quickly a program that's new to us. It's Solutions to End Homelessness program. Toya has had it for years for prevention money, and she'll talk about what she does there. But for us, we have money to house up to 10 individuals. It's an income-based program. So if you receive veterans benefits, if you receive Social Security, disability, any of those kind of things, we can help you if we can find the place to put you, which is also the biggest problem. But I digress. So for the warming station and my piece of this, we actually operate with a mission statement to create a safe, low-barrier place for community members who are homeless to lay their heads in the winter months, or when the temperature reaches 32 degrees Fahrenheit or below. We have 10 beds. So it is a first come, first serve basis. The first 10 folks that show up, they get housed. We also have showers. We have, or a shower, washer and dryer. We work with our partners all across this table. Like Patricia said, in the morning, if you need some clothes, I'm going to send you next door to go and see her. If you call me and you say, I have lots and lots of clothes that I'd like to donate, I'm going to say, call my friend Patricia at Family Services, because that's how you're going to help me help them in that way, because I just can't do it. We can't store it and all kinds of other fun stuff. Like, just think about if I had a jacket that I handed to Sally, who's in cot number 1 over here, and I didn't have one for Jane over here, and it's not good. I'll just tell you that right now. But anyway, so we were born of a coalition of community members, many of whom are sitting in this room, including Patricia, and several years ago, we could not survive without the faith-based community, other not-for-profits. It's truly a collaborative effort. What we've been able to do this year, we work with My Safe Haven, or Our Safe Haven, Our Safe Haven, Your Safe Haven, somebody's Safe Haven. But they work with us and provide 10 meals each evening for our first 10 guests that show up. We get donations from, churches, St. Mary's, Miss Suzanne, the Universal United, people, Main Street Baptist. The faith community really helps us out so much, be able to feed folks, because we're not licensed to do that. So we collect donations and things that we're able to, to provide. Laundry detergent they bring us, things that we can then have our guests use. And we do call them guests. That's how we feel about them. We are in our second year of a 3rd-year lease of what we hope is our forever home. So pray for us that we get to stay there. But our landlord is the Veterans, the Vets Club, and they are absolutely fantastic. And they actually did so much work ahead of time to find out how they could help house us there. As you know, we have had some situations where we've lived in a couple different homes over the last couple years, but we hope that that's where we are. Our success stories, we've had some folks that we've ended up being able to find housing for, which is usually about 1 or two folks that we see during the winter. Also through our collaborative efforts, we have one that we just, actually two folks that we just housed with our help of Opportunities for Otsego and Family Services and our friends out at the Crossroads. We truly, truly, truly depend on one another as well as the kindness of all of you. So that's my piece, and hopefully you don't have questions later. Thank you.
Thank you very much, Jennifer. Next is Toya Lane from Opportunities for Otsego County. She has a very long title and has a great long name tag, and that is Emergency Housing Assistant Program Manager.
Thank you, Reverend, and thank you everyone for coming here today. I want to tell you about a cartoon that I saw the other day. And I wish I had gotten a cartoonist's name, but I did not. They were having a meeting, and the leader of the meeting put out to the group, what should we do about the homeless? So he pointed to one person, and she said, they're sleeping on our benches. Let's put spikes on the benches. Someone else said, well, maybe we should put up bars to keep them out. Someone else said, maybe we should build a wall around our community to keep them out. And the last person that he asked, what should we do? He said, put them in houses. So that's what we all here are trying to do. Again, he said, I'm Toya Lane. I am the Emergency Housing Assistance Program Manager for Opportunities for Otsego. The mayor gave us 7 minutes. I think it was for me. Because I could talk longer than 7 minutes. But I just want to tell you a little bit about Opportunities for Otsego on a whole. And I'll quickly go down the timeline. Some of you do not know what OFO does. And I get that question a lot, and lately people are saying, I've never heard of you. What do you guys do, and how are you helping the people in the community? So really quickly, and I'll look because my memory's not that good anymore. In 1966, they had their first offices in the basement of the Otsego County Courthouse. In 67, the first Head Start Center opened. In 75, they had the WAP program, or the Weatherization Assistant Program. In 79, WIC came to the community. 1980, the offices moved to 32 Main Street. In 83, the Rape Crisis Services began. 91, the Aid to Battered Women. 92, they moved to where we are now, 3 West Broadway. 95, they had the VIP, Violence Intervention Program. 97, Food Bank opened. 99, the Children's Drop-In Daycare Center. 2000, Building Healthy Families, which really helped the community that I know of. 2001, Early Head Start. 2003, Wheels to Work, that's a program that's under me now. And in 2004, that was the ribbon cutting to open up the homeless shelter at 1020 Depew Street. So that's where we are today. But like they all mentioned, OFO had to talk to the community. It was that not in my backyard mentality. We had to, and I say we even though I didn't work there then, we had to have city ordinances, curfews. You had to acquiesce to those around you just to build the homeless shelter. But it's here, and many people can tell you right now, we have rarely had a problem there. And maybe I'm biased, but I think we're like the best place on the block, right? I'll tell you a little description of that, of the shelter, because people didn't even know we were there. That's how inconspicuous we are. But it's an 18-bed facility. At one time, we could house 18 mixed population, children and adults. The state said no more, so now we only house families. There's a full kitchen, people can cook, they can cook their own food, we have food there, they can use their food stamps if they'd like. We have 3 private bathrooms, 2 general bathrooms for everyone else to use. We have a full laundry, and if anybody wants to donate laundry detergent, please drop it off at 1020 Depew Street.
After us. When we close.
And they're able to use, there's no charge, right? Because we have people who are struggling to get out of poverty, people who are struggling to have their own place to live. So we try not to charge anything. DSS, thank you, Steve, pays for their stay there. That one little caveat is that if the person works, and how many of you think that all homeless people don't have jobs? But they do. They just don't make enough money. If they work, we are tasked with charging them a portion of the rent for their stay. But Opportunities for Otsego, we do not do that. So there are times when we do not get paid fully for the stay. It was a 90-day program, and this is how things have changed. Housing is scarce out there, prices are high, and people cannot find a place to live that they can afford to live. So they have been staying over 90 days. And like Patricia said, COVID changed a lot of things. And that was one of the things that changed during COVID, because when 90 days approached, we were pressed to find them a place to live. Now they actually are allowed to find something that is affordable, that is habitable, and hopefully they get to stay there a long time. We have a rapid rehousing program where we help people get into the houses. We pay the security deposit, the first month's rent, and a 3-month subsidy. After that, they come in for recertification. We talk to them, how are you doing? Can you afford part of the rent? And we try to, it's like a sliding scale. So we try to help them get used to the fact that you have to pay rent wherever you go. So we'll pay 100% for 3 months. Then we'll pay 75, 50, 25 until they are used to paying the full rent on their own. And I'm happy to say we have 3 families right now who are, I call it graduating, out of the program and are able to pay their own rent and even have a little surplus left over. So that's a good news story for us, right? Steve mentioned the point in time count. The people you see here, and some of you that's out there, you received an email from me asking you, if you see a homeless person, a person that is unhoused, please count them. Was it January 23rd we did it this year? On January 23rd. I think we counted on our own maybe 20 people that were unhoused, but that was just us. SOS, I see them sitting there. They were also out there counting, and a lot of other communities. So we all have to do this together. I sent to Elaine, I saw Elaine here, she knows, I sent her one. Keep your eyes open, that's all I said. You don't have to engage, just let me know who's out there and where they are. The police department was involved, the fire department was involved, everyone was involved. What this does is we submit the numbers to the state, and they're able to count how many homeless across the United States there are. 2024 numbers are in, over 700,000 people in the United States of America were homeless, unhoused, on the streets in January. It is 18%, I think it is, rise from last year. So it's only going up. Why are people homeless? Housing costs, the economy, sometimes it's alcohol or substance abuse. Sometimes, like they said, they just want to be. Like, you know, you can't make people come in. A lot of people say that to us. Why aren't you doing anything about the guy in the red coat? Because he doesn't want to come in. He can come in. This is America, I think, and we are free to do what we want to do. She's laughing. It is true. So there's a lot of causes, and I won't get into them today. Basically, OFO is there. Opportunity House is at 1020 Depew Street. I sound like an advertisement, but I want you to donate. There's no shame in my game. Right. People that are unhoused, the street homeless, they're out there, and even though I've had people not know who we are, they know who we are. They know who we are. They know who Jen is, and Patricia, and Jeff. Did I miss somebody? They know who we are. And I call Opportunity House a beacon of light, because we're there 24 hours a day, 7 days a week. And they can come and ring the bell, knock on the window, whatever they want to do. And we talked about it earlier, they even come and get a midnight snack, right? Because everyone else is closed, right? Thank you. Your Haven? Safe Haven?
Safe Haven?
Safe Haven?
Your Safe Haven? Thank you.
Your Safe Haven, we got it now. Thank you, Your Safe Haven, for feeding them. But when you're closed, they come to us for a snack. And that thing about sitting next to the person, right? They really are people who are one paycheck away, one late rent payment away from being in that same situation. The other day, my staff told me that one of the, our past guests, he's still out there. And she knew him, I knew him, we knew him when he wasn't struggling as much as he is today. So he came to the window and he asked for a coat, socks, gloves, hat, things they asked for, a sleeping bag, and she gave it to him. And because she knew him in his past life, she talked to him a little bit. And she asked him how he was doing. And he said, "I'm on vacation." Now, he's been out there 3 years. He's on vacation. And she said, "I couldn't believe he said that to me." But you know why he said that to her, I suspect, is because, not because he felt ashamed, but because he saw that she was saddened by his situation. And he wanted her to feel better. So he said, "I'm on vacation." So in other words, I'm okay. I'm okay. So again, thank you all for coming. And did I go over 7 minutes?
Over.
Okay, thank you.
Thank you. Next is the Chief of Police of Oneonta, Chris Witzenberg. Sir.
So I'm here to talk about not the police department, but the community solutions panel that I had a collective group of us formed in 2021 that was the result of many years of the police department looking at problems that we can't arrest our way out of. So in that same vein, drawing from the multitudes of disciplines that we've got out there, whether it be social services or mental health services, rehabilitation support services, other security entities, religious organizations, like Catholic Charities, for instance, and many others. We were looking for a way to kind of wrap around services a bit, and we invited everybody to a panel. And it's an open forum for us to be able to discuss issues that affect each individual organization in ways that we might be able to assist them, like, for instance, the point-in-time count. The Oneonta Police Department's helped with that. Why? Because we're out there more than anybody else is. So, we have eyes on folks that most people may not see. We may know them by name. And most of them aren't law enforcement contacts or contacts that we can't solve through traditional law enforcement mechanisms. So that said, we've incorporated all of these great people to be able to provide a different perspective, teach us as law enforcement what it is that they're capable of doing or not capable of doing, and we've run into that a lot. Many times the conversations kind of devolve into mutual frustration because there's, I think as Toya had mentioned, it's a free country. So we get a lot of complaints about things that we really don't have any jurisdiction over, like someone sitting on a park bench. That's not a law enforcement issue. Could it be? Maybe. Could it be a social services issue? Could it be a mental health issue? Could it be an addiction and recovery issue? These things are really complicated, but when we have an opportunity to bring everyone together and discuss them, we've got a better idea of what the underlying problem might be, what we might be able to do to be disruptive in that cycle of mental health issues or substance abuse. I think it's important to recognize that law enforcement as a whole has been diminished in its capacity to be disruptive in the cycle of mental health issues and addiction. And when I mean that, drug courts across the state have really kind of deteriorated. So there's not a lot of mandated treatment, probation supervision, requirements for addiction recovery services, job searches, that kind of thing. This is almost exclusively involved in the justice reforms that we've had, where we can't set bail on people, which means when we have somebody over a period of time that is an offender, they have to offend again and again and again and again, and they get released perpetually until finally they either have enough failure to appears or their crimes are serious enough where they're now bailable. Now imagine that, where we might have been able to 5 years ago have 2 or maybe 3 violations of law before there's a disruption and a judge sends somebody to the jail, which they're no longer able to do. They're able to perpetuate a cycle of abuse, whether it's neglecting their mental health, their physical health, the cycle of addiction. We're no longer able to get them sobriety. So what we're seeing now is a condition of defendants, criminal defendants, that we're sending in front of the courts that's deteriorated significantly. And in talking to probation, we're sending people to state prison with 0 days of sobriety. So the decisions that people are making while they're in this cycle cannot be interrupted through law enforcement means. We can't force them to go and get mental health treatment. We can't force them to get addiction and recovery services. So we've had to adopt a different strategy, and that's where the solutions panels come in. It was really born out of necessity and a recognition of the fact that if we don't do something, we really can't do anything, right? We've had some successes. I think by and large we probably had more frustrations than anything else, but I think we've developed really good relationships across the board. That's been really important to the community. We have had some great successes. Some of those have been very frustrating, costly. But we found that we've been able to interrupt, in some cases, contacts of over 120 contacts with one person in a year, where we've been able to kind of break that cycle and get them either into recovery services, or at least have like mobile crisis assessment team be able to go out and speak with them, and there's been some success with that as well. SOS was incredibly helpful this last year. I know that they're about to speak on this, but I think having the resources available to us every 2 weeks to be able to discuss the issues that we're seeing on the street level, and having officers have an ability to send an email to the lieutenant or I to be able to bring light to people that might be somebody that we might have hope for helping, has been a big win for the community. I'm not going to take up 7 minutes. I'm sure that there'll be questions after. I'm much more a facilitated discussion person than I am somebody that's going to just sit here and give you my opinion. So on that note, I'm going to say thank you for having me, and I'm looking forward to any continued discussion.
Thank you, Chief. And now we're going to hear from Jeff Cheeseborough, who is the Director of Operations of Catholic Charities of Shenango County. Sir.
Thank you. I greatly appreciate the opportunity to be here. As he said, we're from Catholic Charities of Shenango County. We're going to be putting together a Venn diagram. I promise to, help explain how the charity system works and how we intersect often. The reason I'm here is a couple of years ago, Robin Cotter, who's our executive director, was here, and I saw an opportunity for a multi-county grant. It was called the Safe Options Support Grant, and we were intrigued with it for multiple reasons. Number one, because it seemed like an extremely good evidence-based practice that truly met the needs and filled the gaps of what our traditional homeless services, leave behind, not by choice, but by lack of funding or lack of resources to fill those gaps. And, then we saw that it covered Broome, Shenango, and Otsego County. That's more than 3,000 square miles of territory. However, we were up for the challenge, and we decided to apply for that grant because we, coming from Shenango County, I'm sure Otsego County feels the same way very often, we're sick of being in name only. There are many regional grants that come out, and our rural communities get looped in with urban areas. And it says Shenango, it says Otsego, it says Delaware, it says all these different names, but the service that's actually provided within that community is very minimal or non-existent. So we decided to take our time and apply for this grant, not necessarily knowing the Otsego County region as well as some of the providers here, or the Broome County region as well as some of the providers there, but simply because we knew we are great community partners and we wouldn't have a problem engaging within that community, and we can ensure that every single one of those communities gets served equally and provided the same level of service. So Safe Options Support is a critical time intervention model. It's an evidence-based model that was designed in New York City originally to help aid working with the people who are chronically homeless within the subway systems and on certain city blocks there. They had great success with the model, so they decided to replicate it across the rest of the state. We were fortunate enough to receive one of those grants for one of the upstate awards. Critical time intervention is a model in which, in a very time-limited fashion, we move somebody through multiple phases of care. So unlike traditional outreach models, we do traditional outreach. We do go out in the community. We do identify homeless people. We do go into encampments. We do work with people at that level. But beyond traditional outreach and traditional models of providing immediate assistance to people, we have the ability to engage them in a long-term, intensive level of case management, and also provide, social work and clinical services. while we're working with them with an end goal of not only permanently housing them, but creating a network of providers and a network of services that wrap around that person so that when we take our hands off, they have a complete spectrum of services surrounding them. So far, we've been very successful in all three counties, but one thing I will say is the Oneonta area and the Otsego County community, it has been a pleasure to work here, for one. We've been warmly accepted by every single person in this community that we meet. Our two peers are actually here with us tonight, and if you get a chance, meet them because they are truly awesome. And they are the people that are our boots on the ground that go into encampments every day. They meet people where they're at. They sit down with them and just hear their story and hear what they believe their needs to be. We don't just assume what someone needs. We listen to them and help them educate us on what they think that they need. That helps significantly build that rapport with somebody and help encourage them, because like I've heard multiple times tonight, a lot of people don't want to be housed, or they don't want to access systems, they don't want to access treatment, they don't want to access institutional environments like a Department of Social Services and have to follow through. And as a result of that tends to make them very difficult to manage in the community. They're the people that everyone sees, and they're the stereotypical model of homelessness you'd see in a picture or something like that. Everyone wants to be helped, though, in some way. Everyone wants to do well, and everyone wants to do better, and that's kind of where we meet that person where they're at, and then we work intensively. Sometimes outreach with some people takes years. Believe it or not, we have some people we're working with who probably, to get them to the point where they agree to go into shelter, will take substantial amounts of time, months, years. But we will get them there. Our team is comprised of 9 staff. There's a team leader. There's 2 licensed clinicians. There's 2 peers, Savannah and Maria. And I've been told it's Maria with a J and Savannah like Georgia. Is that the choice? And and 2 peers, and then we have 4 case managers, that are spread across the 3 counties. So what we did to enhance the level of support we're providing in each county and minimize the amount of people that people have to know in order to access our services, we've designated that our peers do the outreach in all 3 counties. So you will see Maria and Savannah frequently in the Oneonta and in the greater Otsego County area. And we have a case manager who is dedicated to the Oneonta area. She couldn't be with us tonight, but if you ever get a chance to meet her, she's wonderful as well. And one of our clinicians spends half of their time in Otsego County and half of their time in Shenango. Ideally, we're currently down a staff in that position, so we have 1 floating 3 counties right now. But ideally, there will be a half-time clinician here as well. And just to give you some statistics on what we've seen, since September of last year, we have approached and engaged more than 100 street homeless individuals who are not accessing services. They are completely service disengaged. That's not including the number of people we've seen or engaged who are accessing services. That exceeds that number. Of those 100, correct me if I'm wrong, Maria, but I think 36 of them are actively engaged with our SOS team. They're not actively enrolled in the critical time intervention yet. I believe only 6 of them have actually agreed to engage in critical time intervention, but 2 of them have been permanently housed now and stably, and they've been reconnected with a lot of the services and resources that a lot of my colleagues here provide in the community. We still are going to diligently work on, the other 30 of them to try to get them engaged in that critical time intervention model. Some barriers that we face, just like many rural counties, the lack of affordable housing. In the Oneonta area tends to be, out of our 3 counties, the Oneonta area tends to be the hardest to identify affordable housing in. Probably numerous reasons for that, but that is a great challenge. When we have a program that's time limited and in 9 months, we're supposed to be getting that person into permanent housing and hand it off to other providers, it does create quite a barrier. Some of the other barriers we've seen in the Oneonta area are, just a lack of mental health and substance use services. A lot of the people we work with, to echo what they said, there's a lot of people who don't have mental health issues or substance use issues who are homeless, and it's more of an issue of the economy and things like that. The people we tend to work with, because the type of model we provide tend to be people who are mentally ill or substance users by default. That further challenges our ability to get them the access to that treatment that they need. I believe the last wait list that was reported to me for the mental health clinic here was over a year to get in. That's devastating to someone who, no matter how intensively you try to encourage them to get back into a sheltered location or housing, when they can't get access to the treatment that they need to stabilize their circumstances, their chance at success is minimized. And I'm looking forward to any questions anybody might have. And I think, am I under 7 minutes? I hope.
All right, yes. So, very good. We have 3 minutes on the clock, on my clock. Thank you all very much. Now's a chance for you.
We still have someone.
What happened? Oh, I beg your pardon. I'm sorry. Yes, how could I have done that? Bad, Paul. Gary Flaherty is the Chief Administrator of Oneonta's Veterans Resource Center, and he's of the Utica Center for Development. And this coming Tuesday, he has a big announcement. So he's going to tell us about all these things.
Well, let me start by saying that, Father, I'm really the new guy in town. On Tuesday, we're going to be opening the Outreach Center for Veterans at the Armory. I got to tell you the story as to how I'm here. I came up in July after retiring from Columbia County as being a Director of Veteran Services there. And I got here because I was working with a veteran's family who had committed suicide. And the young girl had a baby by the veteran who had committed suicide down in a different county than what I was servicing. And she came in one day and she said, I need help because the VA says that my child's not entitled to any benefits. And I'm struggling to get by and may become homeless on my own. Well, we got to working. I was able to establish paternity. And 3 months into it, she had told me she was from Oneonta. 3 months into it, she said, you've been a widow for 7 years. My grandmother's been a widow for 5 years. Before it's over, you're going to be together. And that's how I became a citizen of Oneonta. But I got to tell you, I went in 10 years ago in February to take over the Veteran Services down in Columbia County. And one of the first challenges I had was finding veterans, particularly veterans with post-traumatic stress, living in holes along the Hudson River, living in cars with their families. And I developed a base at the Veterans Hospital, Stratton VA Hospital in Albany, and was able to get all of my veterans placed in housing or assistance. When I left down there in July, I hadn't had a homeless veteran in 7 years. That is my goal. I see the Director of Veteran Services here from Otsego County, and I've only known him a few weeks, and I'm anxious to reinforce what we're doing to help our veterans using him and all the other resources. Being in the Army for 24 years, we were always, as we call in the military, with 3 hots and a cot. Never thought about being homeless because our military took care of us. But it's a tragic thing, and there's a lot of things after I started getting veterans in proper housing that we did as a preventive measure. We started a justice court, and a veteran who was suffering from military-related issues. I had 2 great Supreme Court judges down there, and they would allow, before they would allow a veteran to become homeless, they would call me. And I got to tell you, the VA in Albany was the kind of place where I could call at 3 o'clock in the morning and say I found a veteran on the street, and they would find housing for him. And the same thing if the judge would sentence somebody, he would delay the sentence and give him to me to get into treatment, and we would send him into a drug and rehab and follow up with housing and support bases when they came back to the community. And I tell you this because these are the kinds of things that we want to do in this county and any surrounding counties that we can to support our veterans. Veterans have a unique situation with issues that relate to becoming homeless. Combat stress, post-traumatic stress, deployments, family relations. So when I started building a base down in Columbia County, I was able to start a food bank, which, by the way, when we open up on Tuesday, I have a little room. We're already starting a food bank for veterans. So, and we had the justice program. One of the things that I always thought after retiring from the military that we didn't put enough attention to, all the way up the chain of command, is our widows of veterans. So I had 2 widows that I asked one time to go and talk to a young widow of an Iraqi soldier who was killed in Iraq, and found out that the widow was about to become homeless because she did not want to go out in public and she didn't like her neighbors. So she was going to go live in the streets. Anyway, the 2 widows I had, both of them were, one was Korean War, one was World War II. And they started reaching out to other widows. When I left down there, I had 46 widows, ran the food bank, ran a clothing bank. And I tell you all this because this is the kind of mission that we want to do in Otsego County. How can you help? Anytime you have a veteran, any of the organizations, refer them to us. One of the things that we talked about tonight is the resources that a veteran has. And we can do compensation cases if it's service-connected. And if a veteran's rated at 100%, that's between $3,500 and $4,000 a month, which really helps in finding proper housing. So I know my time was limited, so I just want to tell you it's new. I'm new, and I have great hopes and aspirations for helping not only the veterans but the community that I live in. Thank you very much.
Thank you, sir. I hope you won't court-martial me. All right, so this time we have finished with everybody, these wonderful folks, and now you have an opportunity to ask questions. We have 20 minutes to do that, and I hope that you'll identify who you are and where you're from, and as you talk about your concerns. Anybody have any questions or comments? Yes. I saw 3 hands.
Hi, I'm Michelle Clapperton. I've heard it from almost everybody on this panel that, we don't have a lot of resources for addiction counseling and mental health. And I'm curious as to why there's nobody here from Otsego County Mental Health or from Friends of Recovery. It seems odd to me. Were they not invited or?
So, would you like me to respond?
Oh, I'm sorry, Mark.
We took about an hour with these 7 folks, the representative. We could literally put another half dozen or more people here. So hopefully the folks that have been presenting have, given you a little bit, if not all, of the information.
Okay. All right, thank
And
you.
if you don't mind, the Fordue happens to be, they're housed in the complex, St. James Complex, and we have now begun to talk about partnering together to do grants for housing for people who are beginning recovery. So they're addressing issues. Pardon? Thanks. The fellow in the black back there had a question. Father Micah from the Orthodox Church.
Father Mike, as you mentioned, from St. Innocent Orthodox Church, that's on Main Street. My question was very similar. Can anybody enumerate the mental health resources or substance abuse resources in the area? Or, also additionally to one you mentioned, can you even rename the ones you said so I can write them down? Because we run into a lot of people on the street and in ministry in general. So does anyone have a list or more resources potentially?
I think she mentioned Friends of Recovery, right? Fordue.
Yeah. And in fact, Father, I know that you help out at the feeding ministry. They're in the next building, and they're wonderful people.
So I would like to maybe address the mental health. First of all, the service providers that are available through the county that are going to most likely take your Medicaid or no insured have long, lengthy wait lists, and there's also limited staff. So these are your uninsured or your Medicaid population. And I can tell you, like I said, it's a long, lengthy list, and it's, there's limited staff, and it's the hardest served population with the lowest reimbursements also. And then if you are privately insured, and I can say, and you try to access, it is very expensive to access mental health services just for mere incidental counseling, a separation, a divorce, a loss of a spouse. Those are very expensive and often not covered by, insurance. So just by the way that the structure is, we're struggling. We're struggling. Yep.
If I could just add from the county's perspective, the county has significantly increased funding for mental health counselors and the like, but we're having a very difficult time getting people here to deliver those services. Part of it is just a national and regional demand for credentialed social workers and the like, so it is a struggle. We're working it nowhere near as fast as it needs to be, but no doubt we'll now have more pressure on that because people have raised that here tonight.
And that's exactly another reason why if you know a veteran, any of the organizations know a veteran that needs mental health, substance abuse treatment, the VA has a fantastic program. And I've seen a lot of people come back.
Can I add one more thing? I'd like to add one more thing to that too. As far as folks that sit on this panel, we also participate trying to house folks in a group called Single Point of Entry that works with mental health. And we also, Toya Zana, myself, we have to work through also, and Jen Schultz, thank you, on the coordinated entry program where we also see people that are sent to us as a referral through a list based on vulnerability, based on a lot of factors and things that maybe we're on a regional list, so maybe we have to serve folks that aren't from here. So that's an also added problem of trying to house folks with red tape on top of it through our grants that we are required to participate in coordinated entry. But we try to do that housing first, and the Single Point of Entry, SPOA, works with the mental health too. So we're kind of all at that same spot where we don't have enough people to service those folks once they come our way. But we do work very closely with Fordue as well. They're wonderful. They help me at the warming station as well with bringing folks by and getting transportation there for them. So we do all have relationships with them as well, but that was a great question.
I just want to make a response about the mental health services. My name's Stanley Fox. I'm a long-term resident of Oneonta. We have a free primary care clinic. It's called the Oneonta Community Health Center. It's housed at 31 Main Street, Office 2A. We've been offering free primary care for approximately 15 years. We've received foundational monies for the last 3 years to provide mental health services. We have mental health providers. We have some capacity. We serve the homeless. We take no money from the county. We take no money from the feds. We take no money from New York State. We're fully subsidized by foundations and sponsors and donors. And so I just want to make that known here. I'm here with Beatrice de la Torre, who's our new executive director, part-time. I'm a board member. Our clinicians, our physicians, and our nurse practitioners volunteer their time. We have a dedicated office administrator and nursing staff. We have Spanish translators that come on site when needed. And we're looking to serve the homeless folks. And so I want to make that known. Thank you. I want to give you the phone number. It's 433-0300. Office is 2A 31 Main Street, same building that houses Social Security Disability. So thank you.
Would you give that number again, please?
And we have some information handouts here that Beatrice has. Thank you.
Wonderful. 433.
0300.
Thank you, sir. Very important.
Hi, everyone. My name is C. I reside in Oneonta. Thank you, Dr. Fox, and everyone who's part of the Oneonta Community Health Center, and to everyone on the panel. This is for all you do, and including tonight. It's been really informative. One brief question I have, if folks have experience either with a formal partnership or working more informally with the MCAT services regarding like mental health, people who are experiencing mental health crises, or people who are concerned about their loved ones going through mental health crises, including as they're facing insecurity. Thank you.
Somebody in the back there with the blue.
What?
Yeah.
I was going to say they're on our panel, right?
I'm sorry.
I'm sorry, was there somebody else first? Okay,
Well, I just wanted to respond to the question about
Right.
MCAT.
got it.
MCAT is a part of our panel. They've been vital for us in outreach. We've provided many, many names, including two, I think, just yesterday to MCAT for follow-up. We have an excellent relationship with them, and they're involved in as much as we can get them involved in without actually setting up an office in a police department. So.
Okay, thank you, Chris.
Reverend Cynthia.
I'm Cynthia Walton-Levitt, pastor at the Red Door Church, First United Presbyterian here in Oneonta. I am a resident of the city as well. I am also the Hunger Coalition Network Coordinator. We maintain a network list for in-house use, and then we also have the flyers for food pantries in the county and meal sites that are handouts for folks. Several of you are new and are not on my list, and I'm thinking, and I don't think I'm going to catch you all before you leave. So we have, our primary focus is the food insecurity, so we have food pantries and then meal sites. Our school section is just being developed in terms of what schools have backpacks and what have you. And then we have a housing and homeless section of the network list, and additional folks that are individuals and human service agencies. Some of you have changed people, but you don't tell us who the new person is, so that doesn't help. It really would be helpful if you help keep us updated. I know that the list is used by a number of human service DSS folks and others, but those of you who are new, please let us know. Please email at @segohunger@gmail.org, @segohunger@gmail.org, and give us your contact info. Patricia, I want to know if you want to be under the homeless section as well as Family Service Association, and those kinds of things. If you are duplicate, if you wear multiple hats, like you do for caring for the Homeless Collaborative, if you want to be in 2 different places on the list, that's okay. I don't recommend printing it out. It takes a lot of paper. But anyway, it's otsegohunger@gmail.com. Please send me your information. We'll add you to our network list and circulate it again to all of you.
I was
Thank
just
you,
going
Reverend
to
Cynthia.
add that for anybody who might need that email list, if you want the contact, I know I receive your email list, regularly, and I appreciate it. So if anybody wants a copy, you could also email me. I'm Elaine Mosier-Campoli. My contact information is on the city website. I'm on the Common Council. Thanks.
So it's wonderful to be early, and we're going to take 5 more minutes only for any questions. So does anybody else have questions? Sir.
Hi, my name is Zach Whitney. Thank you for the succinct explanation of a very complicated topic. I was wondering is there a work definition, and it may be different for each of you, what you mean when you say affordable housing? I hear the term often, but I don't hear a functional, workable definition of it, so I'm always a little not sure what that means. Does that make sense? Yeah.
Good question. Anybody on the panel want to try that?
Yeah, I can try to answer that one. Affordable housing basically is exactly its definition. Affordable to me might not be affordable to you, might not be affordable to somebody else, but in generalized terms, HUD creates what they call a fair market value for each community. Otsego County is kind of looped in, so Oneonta is looped into Otsego County. I can't rattle off what the fair market rents are right now. So that's what HUD determines is a median low average for a rental property of a 1-bedroom, 2-bedroom, studio, etc. So when we try to identify what we consider affordable housing, it usually fits within that market range of the fair market value.
Is that based on the county, or when I hear that, I think, well, then that would make sense. It would be hard to find affordable housing in the city of Oneonta because it's more expensive. Like the taxes and everything are higher than the county. Does that make sense?
Yes, and that does happen often because it is a county figure. In the more urbanized or the city areas, it does tend to be harder to find housing sometimes within that fair market range.
If I could add, affordable housing is also somewhat defined in terms of grants and support from higher levels of government to the local government. And there it changes a little bit from the HUD definitions, and it can go down below the county level, so it is, more like a census tract level. But I'm about to nerd out on statistics, so I'm holding back here. I do, however, want to say something that may be the slight bit hopeful instead of confusing. There is in Otsego County an effort to address the overall, I'll just say lack of housing, but especially the lack of affordable housing. And in this county, don't think of that as really poor people who are homeless. They can't get a home, but there's a lot of, I won't even call them working poor, who have a difficult time finding housing. It's broader than sometimes the affordable housing phrase connotes. There is a group under the leadership of the 2 college presidents. It's called the Regional Innovation Council. These things get these kind of names. But they're working on, if you will, a kind of housing strategy to address that overall thing. There was a meeting, I believe it was called a housing summit, actually in this very room, that pulled together developers, state funders, others, to see about how we can address this issue. There was another follow-on meeting for that, and I believe the group is trying to pull together. I think the next step is to focus on, I think, some kind of reach out to developers to see if they can attract essentially new housing of all sorts into Otsego County. I'm not 100% certain the progress for that, but I think we're looking for something soon. The other thing that you need to understand is because we are a rural county, infrastructure is a problem. A lot of beautiful places you can imagine putting homes on, right? But it's difficult to get utilities, et cetera. I got a whole highway department that struggles with just keeping the roads clean, or clean of snow, that is, especially this winter. So there are practical issues like that, and there is some funding for that, but it's difficult to come by because the costs are just very expensive. Imagine running sewer pipes from Oneonta to Cooperstown and having housing being built off there. That's a pretty expensive thing, but there are efforts underway to try and attack that.
Thank you. One last question, because we're down to the end of our time, so we only have one more.
Okay, I was going to answer him, his question, exactly what he was asking.
Okay, maybe we can do it afterwards when we all talk with each other.
That's fine.
One last question, lady in the back.
My name is Anastasia, and I live in Oneonta. So, Mr. Cheesebro, right? Is it correct? So you mentioned that 100 homeless people were served or contacted last year, and only 36 are currently involved, and only 2 are housed, and a lot of them are in a waiting list to get to the services. Is there any opportunity to transfer people so they can get to the services, or are you all talking to each other between the boards to access, for these people to access all of this? And I had another question. Okay, yeah, just go ahead. Sorry.
Yeah, just to clarify, there's no waiting lists. What it is we're not limited on necessarily the number of people we can provide services to. That's the 6 is the number of people who have actively engaged in the critical time intervention, who have elected to take that step to engage in a person-centered planning process and then engage in a time-limited service. What I gave that reference for was, out of 100 street homeless people, only 36 of them become engaged in even having a conversation with us, or even talking to us about furthering, service work with them or getting them connected to other resources. So of those 36, 6 of those 36 have now engaged in taking that step into an intensive case management model to get them into shelter and then into permanent housing. Our case managers have the capacity to serve far more than 6 at a time. So there's not technically a wait list, if that makes sense.
Oh, she's asking about the waiting list for mental health services, actually.
Oh, yes, that's just an estimate we hear when we try to help somebody enroll in services, is we hear that there's about a year wait list. I believe that reference comes from the county-run clinic.
My boss only gave me a mandate for time, but he's giving me an exemption, so here we go.
One more. Just thank you very much. My name is Jennifer Schultz. I am the outreach social worker for the VA Medical Center, so I too work with the veterans and help get them housed. So I've worked with at least half of you, even if it was just an email. So, but no, I just wanted to mention and answer for the fair market rental values as well as the income limits according to HUD. You can go to the website called huduser.gov. They have data sets, and you just look for the fair market rental rate and you look it up by county. They typically do update that about every November. Currently for a one-bedroom, it's just under $1,000 for this county for a one-bedroom. So that is very hard to find. Correct, yeah. And it's always a number that's, it's always trying to catch up. It's always behind because of the census and how they do that data collection on rental rates.
Thank you very much. You know, when we're finished, we can all mingle here and continue to get information from each other. Now we're going to have a little wrap up. I would say, you know, I was looking at the history of homelessness in the United States. The first recorded homeless record was 1640. And then, as time has gone on, the Civil War, and then the 1800s in the United States, where the problem became bigger and bigger. And now, tonight, we have heard about homelessness in Oneonta. And I want to thank these change agents who are present here tonight on behalf of all of us. Thank you. So now the question that we've heard a lot of information, and now we know, and the question is, what are we going to do? Because I feel each of us in community can make a contribution, and I know that my institution wants to do more. I mean, I'm proud of the fact that the St. James retirement community, we partnered to build that, and now it's a magnificent place. For 30 years, we've had a feeding ministry in this town, or food distributions, and we have countless groups that meet in our facility all the time, but none of that is enough. And I know that we would love to partner with any or all for housing. You know, let's find creative ways to have a church institution and somebody else partner and find answers. And you know the book by Eckhart Tolle, The Power of Now. This is all we have, the power of right now to make a contribution for these trailblazers and to help the mayor of this town. Thank you.
Thank you so much, Father. And I want to just ask, Elaine, did you have any takeaway from?
Yeah, I mean, I just want to reiterate, you know, I've worked with, I think, everybody at this table and many of you in the audience here, and I keep reminding folks that what I keep hearing from them is the need for affordable housing. I know it's a priority for our community, and I've been committed to finding solutions for that, and I'd be happy to talk with anybody, you know, who wants to be part of those solutions. You know, we're addressing this on council. We're addressing this through our committee work, and personally, I've been addressing it through advocacy work that I've been doing in the community for over a year now. So I'm happy to partner with anybody who would like to, you know, be part of these solution-based focuses. And thank you, everybody, for taking your time today. It really means a lot to, you know, I know how hard these nonprofits and these agencies work, and they really deserve our respect, and I would like us to applaud them again. Thanks.
And again, I just want to thank you all. You warm my heart to see all of you here. We all understand the scope of the problem from our own unique perspectives, how it's impactful to our downtown and our businesses. It's an absolutely viable concern. It's also a viable concern from the perspective that has been brought to us here by all of our panelists. Here's the thing that I want to just leave you with. We've been saying for these last 3 years and change, we are all in this together, right? And so what I hope one of the takeaways has been is the level of collaboration that we have among our various agencies, some not represented here, but represented by the virtue of everyone here having been connected to them on a daily basis. The kind of collaboration that we have here, I will ask you to see if we can make that much stronger, for the fact that what I will do is put the contact information, not of the individuals here necessarily, but of their agencies. And if you encounter someone who is homeless, or if you encounter someone who is having an issue that clearly needs some intercession, that these people, I will put on social media and we'll put it on our website, on the city's website, the list of these individuals, agencies. You now know what they do. Reach out to them. If they are not going to be the one to be able to help in the moment, they are collaborative, and they will connect up with the appropriate agency and will make that difference. Each one of us individually and all of us collectively can make that difference. So thank you all for being here.